Hi, my name is Danielle Flint, and I'm a Salem State University student in their School of Social Work Master's Program. I'm in a developmental disabilities course, and I decided to do a project on sickle cell disease. My daughter, Ariana, has sickle cell disease. This video's purpose is to educate others and raise awareness on such a hidden disease. I hope this video provides a better understanding for those who watch it about sickle cell disease and how it affects the individual, the family, and the community. My introduction to sickle cell disease occurred when I was pregnant with my first child. Through a blood test, it revealed that I have a sickle cell disease trait. I was given the opportunity to also test my partner to see if he also was a carrier. The blood test revealed that he also, in fact, was a carrier of a sickle cell trait. At that time, we met with a genetic doctor who explained to us that our future children have all 25% chance to have sickle cell disease and 50% that they would be carriers like myself and my partner, and a 25% chance that they will have the full-blown sickle cell disease. My first child, who was born 7 years ago, is not a carrier, nor does he have the disease. Unfortunately, Ariana, our second child, was born with sickle cell SC. You will hear from Dr. Matthew Heaney, who has been Ariana's hematologist since birth, about sickle cell disease, what it is, how it affects the child, and the things you need to do to keep your child healthy.
Hi, I'm Matthew Heaney. I'm a pediatric hematologist, a blood doctor, and I look after Ariana Figueroa for her sickle cell disease. Sickle cell disease is an inherited blood disorder. In the blood there are white blood cells which fight infection, platelets which help stop bleeding when you get a cut, and red blood cells. Sickle cell is the disease of the red blood cell. Inside the red blood cell there's a protein called hemoglobin. There are many different types of hemoglobin in the world. Normal we call hemoglobin A. A stands for adult. When we were all in our mother's wombs, we made something called hemoglobin F. F stands for fetal. And there are many different other types of hemoglobin in the world. In areas of the world where malaria is a big problem, there developed over our species evolution another type of hemoglobin called hemoglobin S. S stands for sickle. And what sickle hemoglobin does inside the red blood cell is it makes it hard for the malaria parasite, that infection, to take hold. Therefore, if you have a person who carries this mutation for the hemoglobin S, they're less likely to die from malaria. And as a result, that gene moves on through the population. Tens of thousands of years later in Boston, malaria is not such a big problem, but we still have left over this gene, which when two people who are carriers come together, they can have a child who has the sickle cell disease, as Ariana does. And so in Ariana's blood, her red blood cells are a little bit different. The job of the red blood cell is to carry oxygen from our lungs when we breathe it in to the rest of our body. Hemoglobin S does that very well, but when it delivers its oxygen out in the bones and in the toes and nose and elsewhere in the body, the red blood cell changes shape because those sickle hemoglobins, they snap together like Legos, the little kid's toy. And when they snap together like that, they change the shape of the red blood cell and they make it more sticky. And therefore it causes blockages. I often tell the kids it's like these red blood cells are delivery trucks and they crash on the highway, and that causes a traffic jam, and therefore nobody downstream gets their delivery, and that causes problems downstream. They don't get their oxygen and various organs or other things that can cause problems. And most commonly the symptom it causes is pain. And so when we think of pain, because oxygen isn't getting to organs, particularly bones, it can cause really significant pain, which is quite debilitating. The other thing that happens in the disease, other than this lack of oxygen delivery and pain, is that the red blood cells don't live as long as in the average person. I know because I'm a hematologist, I've looked, my blood cells live about 4 months. Somebody with sickle cell disease, they might only live 3 weeks or 2 weeks. So because those red blood cells, those delivery trucks, are breaking down so quickly, the bone marrow, where all of our blood is made, works much harder to bring that count back up again. but they're dying off faster than even the very efficient factory of the bone marrow can replace them. So patients are always a little bit anemic. So some people call it sickle cell anemia as well. So it has many, many different manifestations, but it's all related to this one little change in the hemoglobin inside the red blood cell. So people with sickle cell disease can live very full lives. This is a chronic disease that you have to manage and try and prevent the complications from occurring if you can. But even with perfect living as best you can, the complications can still happen. One of the frustrating things is there's a very wide variability. Some people with sickle cell disease have very few problems, and other patients seem to have problems all the time. And it's a little hard to predict who's going to be what, whether somebody's going to have a good time or a not so good time. But for the most part, the things we try to avoid are certain scenarios where you're more likely to cause a blockage of blood flow related to the change in shape of that red blood cell. So typically the things we try to avoid are dehydration, because if your body loses water and becomes dehydrated, the cells are more likely to sickle, change shape, and cause a blockage. So we make sure that all the kids are very well hydrated. They drink when they're playing sports or when it's hot days outside like it is in the summertime, but they always are walking around like a supermodel with a big bottle of water on them. The other thing we try to avoid is really significant cold exposure. You'd think that'd be hard in Massachusetts, but actually if you dress warmly during the winter with a nice hat and gloves and good boots and a good coat, you can actually avoid getting too badly exposed to cold. What cold exposure does is it causes the blood vessels to shrink, and that makes it harder for the sickle cells to move through, and then you get more likely to get blockages. So those are just two of the things that we often do.
Having a child with sickle cell disease was very challenging. At the beginning, the main challenge was accepting the fact that my child was sick. We found out that Ariana had sickle cell disease 2 days after she was born. We had to return immediately to the hospital to get her on antibiotics, as a child with sickle cell disease has no working spleen. Ariana was given these antibiotics and was to be on them for the first 5 years of her life. Fever is a sign of infection. Children with sickle cell disease cannot fight infection on their own and need medical assistance. Ariana had her first fever at 3 months old. When she had her first fever, we had to rush her immediately to the nearest emergency room. There, she was taken by hematologist doctors and was treated with IV fluids, spinal taps, and pain medicine. Hospital stays became very routinely for Ariana. For the first 3 years of her life, she spent many times admitted in the hospital. Sometimes lengths of stay were 3 days, up to 14 days. And other times, she was released but had to be on bed rest when she came home. For the first 3 years of her life, Ariana was hospitalized over 50 times. Having a child with sickle cell disease can be very complicated in many ways. Financially, it becomes very hard to keep a full-time job when you have a child with sickle cell disease. For example, Ariana's first hospital stay was at 3 months. I had just returned to work and needed to stay with her for several months, including surgeries, the first 6 months of her life. Having to be out of work so much caused a big financial burden on us. Many families with sickle cell disease also share this burden, as many employers, although they would love to be very accommodating, cannot when you are missing 14 days at a time. So sickle cell disease is very different in all children, and at every age it changes. When Ariana turned 3 years old, her dosing changed to double of what it was because it no longer had the same effect on her body. At 3 years old, she also started preschool. When she began preschool, the whole center had to be trained by their nurse on sickle cell disease. It is very important that all who care for a child with sickle cell disease are fully informed of this disease and all the signs of infection, pain, or anything that can be detrimental to this child. The staff should know what to do, who to call, and have a specific protocol for this child. When Ariana attended preschool, up until she went to kindergarten, she went to the same center and they were trained on a yearly basis. As Ariana was in the same childcare setting for over 3 years, it became easy for us to be very comfortable with the people that were taking care of her. At age 5, Ariana began kindergarten. At age 5, children with sickle cell disease no longer take penicillin, which means they no longer have that extra boost to help them fight off infections. This means that as a caregiver of a child with sickle cell disease, you have to be a little bit more aware and make sure that your child is not exposed to such illnesses. For example, when Ariana goes to her medical appointments, she's not to wait at the waiting room like other children. Going to school, there has to be a little bit more of a watch on Ariana. You'll hear from Ariana's school nurse on how they made sure that they have a protocol for Ariana and the steps they're taking to keep her safe.
Hello, my name is Maureen Riccici. I'm the school nurse at the Lincoln School in Lincoln, Massachusetts, where Ariana is entering the first grade. She came to us last year entering kindergarten, and we've had to determine several accommodations for her because of her sickle cell disease. First and foremost is the matter of education. As a school nurse, my biggest job was to make sure that all of her teachers know exactly what's going on with Ariana, what the signs and symptoms of her possible problems could be in school, and to know exactly what to do in that case. So I would meet with her teachers, as I will this year when we start school again, and go over some written material that I have that Children's Hospital actually forwarded to me. One of the papers I give them is called the Classroom Accommodation Plan, and in that would be listed signs and symptoms that they should look for in Ariana's behavior or her presence, and what exactly they need to do. Another form that they are given is something we call an emergency care plan, that again outlines exactly, very specifically, what they should do in terms of any symptoms that Ariana should present. One of the biggest accommodations that we need to deal with is temperature control for her. So the teachers are instructed that it's very important that Ariana be kept out of extremely cold or extremely hot temperatures. So during the school year, what this would mean is that if the temperature is above 90 degrees outside, Ariana stays in, usually in the classroom for recesses, or comes down to the nurse's office where she brings a friend and plays a game or reads a book, or they color and draw and spends that time indoors. The health office is also air conditioned, so if the building is warm, she gets that break from the classroom also. In cold temperature, we have as part of the care plan that Ariana will not go outside if the temperature is below 30 degrees, and that includes the wind chill factor, because we follow a very specific chart that looks at not only the air temperature, but the impact of the wind chill on it. In that case, again, she would stay in, either in the classroom or most likely come to the health office, where she would spend time with a friend with us. Teachers also inform that if she's out on the playground and it's warmer than 30 degrees, but she indicates that she's cold, they are immediately to bring her indoors to us or call the nurse. The same thing with hot, if she ever mentions hot. We know she's not to be in front of an air conditioning unit or directly in front of a fan. Another classroom accommodation is hydration. It's really important that Ariana be well hydrated all the time, and all the teachers are informed of that. So if she has a water bottle, they make sure she's drinking, especially on warm days. Another accommodation would be, in most schools, free access to the bathroom. That's not a problem in our school. In kindergarten, the bathrooms were located right in the kindergarten room. In first grade, it'll be just down the hall, and she will have absolutely free access to it at all times. So we have the accommodations for temperature control, for hydration. The other thing we would look at is activity and her fatigue level. During gym class, if Ariana seems fatigued or tired, she would have a rest period either in the room or again come down to the health office. That did not occur all last year. She was able to maintain a full activity level and full participation in school. The other signs and symptoms we teach the teachers about are to look for is any complaints of pain at all. If Ariana indicates that she has pain, or it looks like she's in pain, or teachers notice redness or swelling anywhere on her, or her limping, or not using a body part, or any of those signs, immediately the plan is that they call the nurse's office. Besides that, we're also looking at other symptoms in terms of fever or illness. Any complaints that she has of not feeling well, if she feels warm to the touch, If she looks like she's lethargic or tired, we are immediately called, and the nurses will check her temperature and do a full body assessment to make sure that she's having no signs of either a pain crisis or sickle cell crisis. In terms of emergency situations, we've put a couple of things in place. I meet the beginning of every year with the local EMTs at the fire station and appraise them of all the children in school that have health concerns that they might need to be called for. So they are well aware of Ariana and what her diagnosis is and what her needs might be. Additionally, should we have an emergency evacuation from the school, whether it be a fire drill or a real emergency, we have a plan in place for that, especially in hot or cold weather. If it's extremely hot weather, we will evacuate and get Ariana to the nearest cool place we can, whether it's under a tree in shade or to an air-conditioned building. In cold weather, especially cold, rainy weather, the plan is that there are 2 nurses in the school. One nurse will go immediately to where Ariana evacuates and either take her to a building or immediately to a heated car in the parking lot. When we exit the building at all times, especially in the cold weather, we also take a bag that includes hat, gloves, and a blanket should we need to travel a distance from the school and Ariana needs additional coverage on her body.
Though Ariana has been doing great this past year, her journey with sickle cell disease wasn't this easy. Ariana has faced a lot of medical complications, most commonly pain crisis. Children with sickle cell disease face pain crisis, which is when there's a blockage within the blood, not allowing oxygen to get to the rest of the body. With Ariana, her common areas are her arms and legs. Currently, Ariana has scar tissues in her upper arm from multiple pain crises. When Ariana has a pain crisis, we have to treat her with heavy medication like morphine, Tylenol with codeine, and sometimes it results in being hospitalized. Sometimes her pain is manageable in the home, and we do warm baths, relaxation. Another complication Ariana has faced is having pooling of the blood in her spleen. Like I mentioned before, children with sickle cell disease have no working spleen. And sometimes the blood likes to collect itself in that area. This has resulted in children needing to have their spleens removed. Luckily, Ariana has not had to have that happen. Due to the many medical challenges children with sickle cell face and all the extra precautions us caregivers have to take, I feel that it's most important to educate your child, age appropriately, what sickle cell is and what it means to have sickle cell. What are the red flags and how to understand your body and how to communicate that with the people that are taking care of you.
Feeling your pulse. Now I'm feeling for lumps and bumps in your neck. Ow, ow, ow. Ow, ow, ow. Now look in your ears. Alright, see if you have a heart. You have one? You don't have a heart?
I don't have a heart.
I hope you do.
My name is Ariana Figueroa and I'm 6 years old and I have sickle cell disease.
What does sickle cell disease mean?
Now I'm always sick, so I can't go in cold water, nothing that's cold. I only can go like hot, but I have to keep drinking water if I won't get dehydrated.
And does any part of your body hurt because you have sickle cell disease?
Sometimes my legs hurt from the purpleness on my legs. It kind of like hurts a little bit. And when it goes on my arm and it hurts somewhere, right here or something, it hurts a little bit. When I'm sick, my mom has to take me to the doctors and go to the emergency room.
Why?
Because they check me out if there's somewhere pain, and they have to help me with it. When I was at school, they had to call 911, and Miss Suzanne came with me in the ambulance so I won't be alone.
Mm-hmm.
I was feeling so sad that I missed school.
Oh, really? What happens when it's cold outside and they have a fire drill? Tell me.
I have to go in Mr. Chichi. Mr. Chichi is like her car. Wait for a little bit until the bell is done.
Okay, why? Why can't you stay in the cold?
Because I might get sick.
You can't be in the cold?
I can't be in the cold because I might turn purple. I might get like sick or like keep coughing and coughing all over again. So that's why I can't be in cold water or in snow. I have to wear snow boots, a scarf, a jacket, mittens, and a hood or a hat.
And what do your friends say about that?
They always take me to the nurse's office if it's really cold, and I get to draw until the class comes back. So once it was 30 degrees and I did not want to go for half an hour, and then I came back to play for a little bit.
Okay, that's good. That's good. So what would you tell like another kid that has sickle cell disease? What would you tell them?
There was nobody else except me with sickle cell.
You don't know anybody else?
Yes.
Nobody else you know that has sickle cell?
Only me.
Okay. But if you had to tell somebody that has sickle cell disease and didn't know about it, what would you tell them? What's going to happen?
You cannot be in cold water or be in like snow. You have to wear snow boots, snow pants, a jacket, a hat, and a scarf.
To stay warm, right?
To stay warm.
Okay.
If you know someone that has sickle cell disease, you should be kind, nice, be friendly, help them if they got hurt, and be really nice to them. And if they're tired, hang out with them for a little bit. And if they're lonely by themselves. Done.
Have you felt lonely?
No.
Because you always have friends around.
Yeah.
That was good.
I hope you found this video to be informative and have a better insight on sickle cell disease. I want to give a special thank you to Dr. Matthew Heaney, who's Ariana's hematologist, Maureen Richichi, her school nurse, Digna Jarina, Ariana's grandmother, who helped me put together this video, Patricia Connolly, my professor, who allowed me to do this video as an assignment, and also Ariana herself, who has taught me the real meaning of being a fighter and a survivor.